Okay, welcome to today's webinar. My name is Elise Lowe. I'm with the India program at America World, and this is a webinar on the adoption of children with HIV, both adopting and parenting the HIV-positive child. Thanks so much to all of you that have joined us today, and we are also joined by Dr. Patrick Van Winkle. Just wanted to introduce the webinar and give a little bit of background on him and just the motivation behind doing this webinar today. We have seen a consistent need in some of our programs for families open to HIV-positive children, and Dr. Van Winkle has a personal passion for that and for adoption. He's been a friend of America World for a long time now, has adopted through several of our programs, and is a medical consultant for us as well, and he is just well informed on the subject of HIV, not just as a medical professional, but as a parent that has walked that journey with his own children. And so we're really excited for him to be here today. And as I said, you know, the India program specifically really has a need right now for families open to HIV, and that's really been a consistent need in the last 2 years of our program. So we started thinking about and talking with Dr. Van Winkle about what we could do to bring some education around this, to bring some advocacy around this, as we consistently see families open to lots of different medical needs, but still have a need for families open to HIV specifically. I could tell you names and show you faces if I could of families and children right now that are waiting for families. So in our Haiti program as well, we have that same need. And so wanted to just host this today to give families some education and awareness around this. And there's also going to be an option for you to type in questions at the end of the presentation if you'd like. We'll do our best to answer some of those. But if at the end of the presentation you would like further information, you can always email india@awaa.org, or you can email haiti@awaa.org for more information about either one of those programs. And I know Dr. Van Winkle is happy. Him and his family have been a reference in the past, and he's happy to talk with families that are seriously considering adopting an HIV-positive child. So with that, I'm going to go ahead and turn it over to Pat, and we will get started.
All right. Hello. Good afternoon. Elise, you can hear me?
Yes.
Okay. All right. Excellent. So everyone, thank you for coming. I have worked with AWA for a long time. I absolutely love their heart and what they do, and you are in good hands. So I think that is probably one of the most important adoption decisions, is the agency you work with. So you're already on the right path. So Elise, if you could advance to the next slide.
Sure.
Thank you. So what I'm going to do is we'll do I'm just going to give you an introduction. We'll look at some facts about HIV, what life is like living with HIV, and then HIV is a social more than medical problem, which is definitely the case in our country. In the world, it's a medical problem where there are not medications. Here it's more social. And then I'll talk about resources. And then my daughter Talia, who I'll talk about in a second, is 9 now, so she's going to come in. That might probably be the best part of it. I'm not going to take up too much time before that. And then we'll have some questions at the end. So next slide. So who am I? So I'm a pediatric hospitalist. So I'm a pediatric doctor that exclusively works in the hospital with a lot of chronically ill children, but then also children with asthma or appendicitis or just whatever they come in with. We have, my wife and I have been married 20 years actually this summer, and we have 4 children through adoption. Our oldest son is Trent. He is 14 now, going to be entering high school. He is adopted from Korea. And then we have Diana, who's 12. She was adopted from China. And then Talia, who's 9, adopted from Ethiopia. And then Dean, who is now 4, and we adopted him through foster care, just local foster care in LA County. He actually was born in Compton, which he finds very funny. So in terms of the adoption of Talia, we did adopt Talia through AWAA. in the Ethiopia program. And kind of the theme I want to give to you kind of throughout this time we have is that adopting a child with HIV is definitely not easy. It's emotionally, it can be emotionally difficult. It can be socially difficult in terms of special needs adoptions, of which I review for AWAA. I've reviewed, I don't know, hundreds probably over the last 10 years. But I can tell you that it's not so much of a medical problem as all these other things. So for my wife and I, for me, it was, kind of easier. I knew about HIV, professionally. My wife did not know anything about it. She was very scared initially and had a lot of fears about the medical parts of it. So it was definitely a process for us, but kind of once we got in line with the medical side and then got a sense of the social side by talking to people, we were pretty ready to go. And in our family, I'll talk about this a little bit later, but about 99% of the people that you interact with this have a very positive response to it, and then the other 1% don't. And obviously that percentage can change depending on where you live and your group. But for us, we did have part of her immediate kind of family with her cousins and that did not respond well at all. That was a very difficult process for us. So all that being said, I think being in Ethiopia and the day we arrived home with Talia was truly one of the greatest days of our life. And it's an interesting thing about all this. And for those of you who have adopted before, have biological children, you'll know this, that once the child comes home, it's just your child. And then all this other stuff just kind of goes away in a sense, and you just take care of your child. So next slide. So just there's a lot of HIV facts. I just pulled out a few that I thought were relevant to our conversation. So one of the most interesting things is that in some places, especially in the United States, among adolescents and young adults, the number of people getting HIV is actually increasing now. And the reason that is a lot is because people have lost the fear about contracting the disease. We always talk about, my parents' generation are incredibly afraid of HIV. My generation, kind of 40s, 50s, is, kind of split between not that afraid of it and very afraid of it. When you talk to 20-somethings about HIV, they don't think it's a big deal. To them, it's diabetes or, some other kind of low-grade chronic medical condition. So people have kind of lost the fear about that. So and people who are engaging in risky behavior are kind of not thinking about it that much. So in the U.S., there were 40,000 diagnosed in 2015. The interesting thing is, so of the people living with it, still 13% don't know they have it. And worldwide, that's even higher. So that's a very interesting thing about the disease, is that, up to 20% of the people that have the disease in the world, almost 30% don't know they have it. So in terms of the world, 2.1 million new cases in 2015, and then 36.7 million people living with it. That was in 2015. So, all right, next slide. So kind of getting into kind of, I think it's a little more interesting. So what is it itself? It is a virus. And I always tell people it's kind of like herpes virus. When you get a cold sore, you get a cold sore once, and then when you get sick or you get stressed or whatever it is, that cold sore can come back. Well, that herpes virus lives in your nerve cells, and it kind of comes out when it wants to. HIV is kind of the same way. So it is a virus that lives in a part of your immune system, and it just lives there. But as of now, there is no cure for it. You cannot get rid of it. So it does stay in your body, and it lives in these cells. So in terms of how it is transmitted, so there are basically four ways it is transmitted: by blood, breast milk, semen, and then vaginal fluid. So, and basically, you need to have contact with a mucous membrane or a damaged tissue, or, of course, if you inject it directly into the bloodstream. So, the important thing is that that has to be some pretty significant contact. Like there are, there are different statistics out there about like people who are married who are having sex that say they don't know. There are people that have been married for years having unprotected sex, and if one of the partners have it, they don't transmit it to the other one. If you, like in the medical field, we have exposures sometimes to HIV and other things, and it's almost never contracted because you do have to, you have to put it in a syringe and a needle and inject it into your veins in a sense. So even when dealing with blood, I of course recommend that people use universal precautions when dealing with blood. I can tell you for myself, and one thing I just back up for a second is for 13 years we were overseas for about a month a year doing medical work, both with orphans and through our church and other things. So I don't actually work with that many people with HIV here because I'm a pediatrician and kids that have HIV are healthy, so they're not in the hospital. But overseas, we've definitely worked with them, and like things like when I'm drawing blood from someone, it's harder for me to feel the veins when I have a glove on. So like a lot of people that draw that blood, they don't use gloves, because the reality is if a little bit of blood from a person with HIV gets on you, you're not going to get it. But through sex, through blood transfusions, you can definitely get it through breast milk. A lot of infants who get HIV across the world don't actually get it from pregnancy. They get it from the breast milk. You can definitely contract it that way. So HIV is not transmitted by air, water, saliva, tears, normal kissing, like kind of, it would be weird, like aggressive, like biting or that, you could get it through that. Insects or pets, sharing toilets, foods, drink, sneezing, coughing. It's not transmitted in these ways. So another important point is the higher your viral load, the more likely you are to transmit it. So someone who is not being treated has a lot of the virus active in their body and their blood. So if you get exposed to that blood, you're a lot more likely to get it. For most people who are on treatment, like for Talia, she has undetectable amounts in her blood. So it lives in these immune cells, but in the blood itself, you don't find it. You have to go looking for it. So in that type of a case, it's a lot less likely to transmit it. And then the other thing is that the virus does not live long outside the body. So if there's blood on a surface, within a very short period of time, that virus is not active anymore. So in terms of how it is treated with right now a combination of 3 medications. And like right now for Talia, she'll tell you one of her medications, one pill is a combination of 2 medications, and the other pill she has to take by itself. For a lot of people, like for Talia, in about a year from now, she'll actually take 1 pill once a day. That will be her total treatment, because that 1 pill contains all 3 of the medications in it. So, okay, next slide. Okay, so living with HIV. So in terms of medication, people normally start off taking it 2 times a day, in the morning and at night. And then, when you're younger, you take up liquids, which is actually, that's a pain when you're under 3 because the liquids don't taste great. So that part is a lot more troubling. Most kids by the age of 3, if they have a chronic illness like this, learn how to take pills pretty easily by the age of 3. So when you get to 3, you switch over. You go to the doctor, get your blood drawn 3 to 4 times a year. In terms of lifespan, if you take your medications, it's basically normal. Now, one caveat to that is if you get cancer, or if you have lupus, or if you have ulcerative colitis, or some other kind of chronic illness that you have to take medications for, in that you'll definitely have to deal with the HIV, Because say if you have cancer, you're going to take medications that suppress your immune system to help with the cancer, but then you take those medications, it might make the HIV a little bit more active, so you might have to adjust your HIV medications along with that. And that would go if you were chronically on steroids or some other type of medication. You know, you're definitely going to have to deal with it. And the reality too is for these kids right now, you know, we know from people who are older that have HIV, who have normal lifespans, but you know, a lot of these kids now who've gotten it from birth, you know, we haven't had it for 90 years yet or 100 years. So we don't really know, you know, are their lifespans really going to be the exact same? Are they going to be a little bit less? Or kind of what are they going to be? And the other thing too is the medications. You know, we don't really know what it looks like for someone to have taken HIV medications for 80 years because it just hasn't been around that long. So these are definitely questions that, you know, 7 years from now we'll know the answer to, but honestly, until then, some of these questions we won't totally know the answers to. So one of the things that was very important to my wife and I, and I'm sure it's important to everyone, is the whole issue of, you know, do you have a normal life? Can you have a normal job? Can you get married? Can you have children? You know, can you be can you be in the military? Can you be an athlete? Can you be all these things? And the answer to these questions is yes. You know, definitely with the marriage and having children, a lot of people now who are younger are getting married, and of course there's a lot of people who are married that have HIV. And then having children, a lot of people now are deciding to have children. So there's a couple of things. So in terms of your, say you're married, so say Talia is married, so for her husband. So right now there's a medication that if you want to have unprotected sex with someone that has HIV, you take this medication. It's one pill. You take it once a day. It's called Truvada. Basically your risk of contracting the disease through unprotected sex is almost zero. It's never going to be zero, but it's very low. So some people have chosen to do that. You can obviously artificially inseminate as well. And then for the baby itself, currently the risk is less than 1% of the baby contracting HIV. So there are a lot of diseases that, you know, when couples are carriers of it or whatever it is, they have to decide. Like hemophilia would be one where, okay, are we going to have a child and risk them having this disease? So HIV now falls into that category of, if you're thinking about having a biological child, you know, you should get counseling to fully go over the risks and all of that of doing it. But it is a, you know, the risk now, you know, basically 99 times out of 100, that child is not going to have HIV. And you know, these things are going to get, you know, Talia's 9 now. By the time hopefully she doesn't have her first baby until her late 20s maybe. You know, so you know, it's just the advances in medicine in this area are moving quickly. Okay, so next slide. All right, I'm well over halfway done with mine. I probably have about 10 minutes, and then we'll bring Talia in. Elise, is that okay?
Yeah, that's great.
Okay, all right. So I know when I talk too long, I actually bore myself. So again, so HIV is medically simple, socially complex. I talk about this 99% rule. You know, what we have decided to do is we have decided that people who are, you know, the decision of who to tell is a big decision. And my recommendation is that, like in the clinic Talia goes to for HIV, there is a doctor, there is a social worker, there is a nurse practitioner, there is a dietitian, there is a counselor. You know, they have a full, in any you know, significant HIV pediatric clinic, they have a full set of resources. And for every family, this is a very personal decision, and there's not a right decision. So some people tell no one. Like if you ask Talia's doctor, he's like, tell no one. Don't, you know, he's like, if your parents have to give her medicine, tell your parents, otherwise don't tell anyone. It's not their business. It's her medical information. It's for her to tell, you know, when she's older. So we you know, but so we talked to her, you know, the counselors and all those other people, and you know, for us, we really felt like people who are close to us, people who are in our home, people who are praying with us, praying for us, we want those people to know, because we want to, you know, we have a connection to those people. We felt like not telling them, you know, because they're going to find out eventually, you know, when she's 25, they're going to find out. So, for us, we felt like we should tell people. And we felt, kind of the main reason we felt that was because we don't want people around her who do not love her and accept her for 100% of what she is. And we don't mind losing those people if they can't deal with it, but we don't want them around and to have them be really close to her and then have them find out and then not be around, or to feel differently about her, or to judge her, or to do that. So there's so for instance, our close friends that come over and play with our kids, they know. At our church, we're at a pretty big church, so the pastor knows, and the person that runs the student ministries knows. But we ask them to not tell other people. But we want someone in church to know. In school, depending on your situation, you might let the principal or someone know. And the reason we want those people to know is because we want to make sure their volunteers are using universal precautions. Because if she gets a bloody nose, honestly, I'm not worried about her giving HIV to the person that's helping her. I'm worried about the person who's helping her freaking out and causing all kinds of trouble because they were potentially exposed to HIV and they weren't, and all of this stuff. So I just don't want to socially have to deal with all of that. So that's why kind of people in positions like of authority at the church, we let them know. So then if it comes up, our pastor's known for 9 years. So if someone has a problem with it now, he doesn't care. They go to him, he tells them, look, deal with it or leave. So I don't mean to be blunt or, but it kind of is what it is. So, and we, again, with our family, we actually went to church with them, and they left that church, a Christian church, because she was there, my wife's cousins, which, I'll tell you, having a child with HIV can teach you a lot about grace and forgiveness. It taught me about grace and forgiveness in a way that I kind of hope to never have to learn about it in my life. But that part of it, and for us, 70% of people that know that she has HIV, they love being a part of it. They are excited about her life and her, and they love her, and it just endears them to her. Some of the other people that know that are close to us are fine with it, but it's not something that impacts their life in any way. And then again, we had my wife's cousins who still live a half a mile from us, we actually haven't seen in 9 years. We have a next door neighbor who when we had like one of our friends, and this is the problem with telling anyone, is one of our friends told her, and she just couldn't cope with it because she had little kids, and so they, we ended up moving a couple of years later just for normal reasons, but that was, they kind of boarded up their house, which was interesting. And then, and we've had one other friend who we've been friends with for a long time. We actually walked through when their children died, we walked through that with them. And they feel horrible about it, but they just can't. They have this weird fear about it. So, and I'll just talk about this for one more minute, because one of the things about it is when we tell people, we have these little information sheets that we give them or we talk to them. And I find that people often kind of either get on board or they struggle with it a little bit. And when they do, it's hard to objectively bring them out of it. So, the reality is of getting HIV from someone that you have casual contact with, you're like 100 or 1,000 times more likely to get struck by lightning in Southern California than you are to get HIV from that person. You're 1,000 times more likely to get killed on the way to the supermarket in the car than you are to get HIV from that person. So, but the reality is for just there are isolated groups of people that it's really difficult for them. So anyway, so that's enough about that for now. So in terms of danger to other people in the house, friends, so the reality is if you follow these common sense rules, you probably won't contract it. Funny enough, Talia had nosebleeds pretty significantly for a little while. So we'd always, my wife and I and whatever, we'd have to deal with her nose all the time. And it just, I think because of the work we've done, it just never, I don't know, it just, even for her, it just was never been an issue for us. We do not get tested. The people who live in the house of a person with HIV do not get tested. If you are having sex with someone that has HIV and is unprotected, you should be tested. If you are doing IV drugs with someone that has HIV and you're sharing needles, you should be tested. Or if you're drinking the breast milk of someone with HIV, you should be tested. Or if you were born to a mom that has HIV, you should be tested. Those are the main times you need to be tested for HIV, or you need to worry about getting it. The reality of HIV is it's a pretty hard disease to get. You often have to kind of work hard at it in order to contract it. So next slide. Okay, so in terms of resources, basically, you need medical insurance. You definitely need access to a pediatric HIV specialist. Until the kids are about 14, maybe 10 for sure, they should be seen by a pediatric HIV specialist. And any major medical center is going to have them. We see Talia's about 3 times a year. And then you either have to have medication coverage or you have to have money to pay for it. HIV medications are actually not that expensive, but you do have to take them every day forever. So, if you don't have coverage, I don't know, most people have coverage because they're generic medications. So it's, it's whatever, $5, $10, $25 every 3 months for your copay. If not, it'd be hundreds of dollars. I don't know. I should have found out for you guys. I don't know honestly what it would be a year if you're totally paying out of pocket. But that's definitely something you'd want to see. So, and then one last thing, Elise mentioned this, so I'll just say it now. We'll say it at the end. Is I'm happy, and my wife and I do talk to anyone seriously interested in adopting a child with HIV. You kind of want to have mentors in this process. So we are happy to be that. And our phone numbers are also listed in the AWA website on the reference pages for Ethiopia and for China. And then Elise has my information. I just basically have people call my cell phone and we talk. So next slide. Okay, so Talia, hang on, let me get her. I had her wait outside, one, because I want to do her schoolwork, and two, just so we can have that general talk. And again, if you guys have any questions, you can put them up. If you have any questions for Talia when she talks, you can put those up too. Hang on one sec. All right, hey, money. Not going. Okay, yep, sit on stool right there. Okay. All right. So let me turn this. Let me make sure. Oh, isn't she pretty?
Hi.
Say hi, Talia.
Hi.
Hi.
Hi, Talia.
All right. So Elise, do you mind advancing to the next slide where my questions are? Okay. So these are my questions for you, Talia. We look alike, huh? Okay. All right. So so tell us how old you are.
I'm 9 years old.
Okay. And Elise, can you hear her?
Yes, you're doing great, Talia.
Okay. So tell us who's in your family.
I have 2 parents, Pat and Casey, an older brother named Trent, he's 14, an older sister, Diana, she's 12, and a younger brother named Dean, and he's 4.
Okay. All right. Great. And then what grade are you in?
I'm in 4th grade.
Okay. You're in the 4th grade. Okay. So what do you like to do for fun?
I like to play outside with my siblings. I like to play board games, and I like to read and spend time with my family.
Okay, all right. Do you play any sports?
Yeah, I play basketball, and I run in track, and I run the mile.
You run the mile? All right, that's a long ways, huh?
Yeah.
Yeah, okay. All right, so how old were you when you were adopted?
I was 10 months old when I was adopted.
Okay, and where were you born?
I was born in Ethiopia, which is in Africa, and the orphanage was in Addis Ababa.
Good, very good. All right. Okay, so what do you know about HIV?
I know that HIV is a disease, a virus disease that has to be taken seriously, and it's something that I have, but we use it in a good way because we know how to deal with it.
Okay, all right, good. All right, make sure to smile. Yeah, there it is. All right, good. So, how much medicine do you take, and how do you and how is it taking it?
I take 5 pills a day, and I think it's good taking it because it's easy to do, and I can get in a habit of taking it.
Okay, that's good. Yeah, I have an alarm set. My wife has an alarm set. We have signs up because you forget, huh?
Yeah.
And then we forget, do we blame you?
Sometimes.
Yeah, then we blame you, right? Okay, good. All right, so you take the pills now. So when did you start taking pills? How old were you?
I was 3 years old when I started taking pills, and before that, I took liquid.
Okay, how was the liquid?
The liquid tasted really bad, and so I don't miss it.
Okay, you don't miss it, right? It was gross, huh?
Yeah.
Yeah, okay. All right. So, all right, tell us about your doctor.
My doctor is Dr. Arietta, and I like him because he makes sure I'm doing well physically and emotionally, and he makes sure my family is doing well. And I also like him because he makes HIV not feel like a problem in my life.
Okay, good. Now, who's your favorite doctor? Is it Dr. Arietta or is it me?
It's Tom.
Okay, all right, good answer. He doesn't, right?
No.
Yeah, he doesn't feed you. Okay, all right. So tell me about having your blood drawn.
I get my blood drawn 4 times a year, but I don't think it hurts because I'm kind of used to it, and I only feel like a numb feeling for a couple of seconds, and then it's done.
Okay, good. So, and I will tell you, you guys, that so Talia, I think the Lord prepared her for having HIV because she really, even when she was younger, never minded getting her blood drawn. She just goes up there and puts her arm out. Definitely not all kids are that way. Some kids, my other two would cry to no end if they had to get their blood drawn, huh? Trent and Diana. Yeah, and then taking her medicine. Talia's always been very good about taking her medicine. And some kids don't like to take it. I do with cancer patients and patients have a lot of chronic illness, and some kids are really good at it, it doesn't bother them, and some kids don't like it. So, we're very fortunate with Talia in these regards. It's not always as easy as she's saying, but it is always manageable. Okay, so how do you feel about having HIV?
When I look at HIV, I know it's a disease that I have, but I don't think it's affected my life negatively, and I feel like it's actually been a blessing for us, and it's also taught me responsibility and how to deal with something serious.
Okay, all right, good. And what do you want to be when you're older?
I want to be a doctor, a neurosurgeon, or a scientist.
That's a thumbs up for me. Can you see that? That's a thumbs up, Talia. Okay. What was the other thing you wanted to be?
Or a scientist.
Yeah, but what was the other thing that was in English?
Oh, since I really like to read, I might have wanted to be a book editor.
Right, but we're trying to really discourage her from reading and from becoming a book editor. We think scientist is better.
Yeah.
Okay. All right, so and then Elise, do you have other questions for Talia?
Talia, I think you've done a great job sharing about your own life, and we so appreciate you being with us today. Thank you.
All right. Okay, so Talia, go do your work, and then if I need you again, I'll call you back in. Good job, now.
Okay.
Okay. All right. Take care. Close that door for me. Okay. All right. So now, if any of you are looking at my face, my apologies from going from Talia's to mine. Oh, hey, Elise. Oh, that's better.
Okay, so I thought we could, Doctor, do you want to transfer to some questions? I see we have some questions typed in here. And
so do I click on the?
Yes, if you click on it, you can see the full question.
Okay, all right.
Oh, let me point out before we get started on that, because the first question is about it, there are some handouts actually attached to this presentation. So if you're attending, you can click on the handouts section, and we've put 3 handouts there, an HIV adoption parent education packet, an HIV information sheet that Dr. Van Winkle actually wrote for us, and then the last one is a packet from an organization called Project Hopeful. They do a lot of advocacy around HIV positive adoption, and this is a really good packet that goes into some practical questions that families have, like pregnancy, like social stigma, like who to tell, a lot of the things that Dr. Van Winkle's talked to us about today. So you can go ahead and download these 3, and that way you can reference them. You can also always email india@awaa.org, and I can send you these types of resources or Dr. Van Winkle's contact information, but we just thought it'd be convenient for you to have them there. So feel free to download those, and then can move through the questions.
All right, and then one point on that. So the Project Hopeful information is great, and kind of when you're talking to people or when you're thinking about the Centers for Disease Control and then the World Health Organization, those are two bodies, the Centers for Disease Control in the United States and the World Health Organization in the world, that pretty much anyone in medicine defers to their expertise on these types of issues. So they actually have very good parent or family or living with HIV pages. So whenever I'm giving someone information, I like to reference those two places because then there's no question about the validity of the information. And those websites are on there as well. So let's go to this one. So yes, okay, so this is a great question. So the question is, aren't there risks of transmission from simple things like sharing toothbrushes? So if you, basically what you need is blood, and you need blood in a pretty, like for someone like Talia who's on medications, who has undetectable levels of HIV in her blood, you need a good amount of blood, and then that blood has to get directly absorbed into your body. So, and you'll see on these things, like we, in our household, with the kids, we like sharing toothbrush is not something that we do. So now, do I think you're going to get it from that? I don't. There has been cases like with people with hemophilia or the bleeding problems, where I think they actually shared toothbrushes. I don't know if that's why you're asking that question, but there is a case of that. But I think the person that got infected was a hemophiliac who had a lot of bleeding issues. So yes, and again, what we say is if there is blood involved, then you need a barrier. That's our thing. So whether it's a cut, a nosebleed, if there's blood on your toothbrush or whatever it is, then yes, we recommend a barrier. And again, I think our kids, we have 4 kids, they share 2 rooms, they share 1 bathroom, things happen, they use each other's toothbrush and do all this kind of stuff. And honestly, I think just for me it's easier. Obviously I've been around HIV since the 90s, so I just know that, again, if I'm going to worry about something, it's going to be getting hit by a car and killed on my way to the grocery store, because that's so much more likely than this to happen. But and I'm probably on the, I'm going to be more on the side of very casual about it. And there are definitely, we know a number of families that have people with HIV, that have adopted children with HIV, and some people are a lot more careful about it. Like for me, when Talia's at basketball practice, she's 9 now, she knows her friends on her team, I'll leave, and go do something and come back. For other people, they don't leave their child because if she gets a nosebleed or something happens, they want to be there and, take care of it. I mean, I just tell Talia, look, if your nose bleeds, excuse yourself and go get a paper towel and take care of it. Don't let people touch your blood. And she's like, okay. So, to me, you kind of just live your life with it. And the other thing that's interesting, and I'm a little bit biased, maybe living in Southern California, is there are a lot of people that have HIV. Some of them know it, some of them don't know it. We're by Disneyland, and the funny thing is the people that have the most trouble with HIV, these few isolated people, they all go to Disneyland all the time. And like every 4th person that works at Disneyland has HIV. That's an exaggeration, but there's so the people preparing your food there, the people cleaning the rides there, the people, so it's even in the schools, because I'm a doctor, I know, in our school district, there are other kids that have HIV that people just don't know about, so and it obviously depends on where you live, but, in our world, it is around, and even though people don't realize it. And the thing too is, if you get it when you're younger, you're going to live with it until you die of some other cause. So it is around, but yes, and that's why for each family, who they tell, how they deal with it in their house, these are all things that ultimately that you need to be comfortable with. so yes, I don't want to present it as there is no risk, because of course there is risk. But I think that and, and and then there's other kind of issues with the Christian community and HIV, I think, that are more deep-seated, that are more. I don't want to get into them now, but I think that as a group of people, I remember when it came out, people thought, oh, this is God's plague on so there's a lot of issues around it. And I know I'm getting off topic, but I think we really had to think about it from our Christian worldview, and what would God have for us in this situation, and biblically look at it and all that. And I think when you do it that way, for us personally, we're like, well, this makes a lot of sense now, but there's a lot to it. So I'm sorry. I know you asked me about toothbrushes, and I really got off the track, but that's just how I am. You're not paying me to do this. I can kind of do whatever I want, right, Elise?
Exactly.
So, are there severe risks of additional complications from other conditions or illnesses that arise? Yes. So, like I was saying, if you have cancer, if you have a chronic immune deficiency of some other sort, you're going to have to deal with this. But I can tell you, the majority of the time, it's manageable and it works. Like I'll say, it's better. Say you had cancer, it's having HIV would be similar to having like say you had heart disease or anything else. I work with a lot of cancer patients, a lot of chronic ill patients, and they often have kidney disease or heart disease, or your blood is an organ. This is how we look at it, like your heart, your liver, your kidneys, your pancreas. Your blood is an organ like that in that sense. So whenever you have a problem in one organ and you have another organ that also isn't functioning well, you have to deal with that. So yes, it can be, and I think that, if honestly, if you are looking to adopt a child that you want to be confident is going to live to be 90 and not have difficult social situations and not have medical problems, this is not your child. When we adopted Talia, it was kind of early on, and they didn't really know her viral load, and they didn't know much about her. And my wife and I, kind of came to a place where, like, look, if she lives 3 years, then we're going to give her the greatest 3 years that are humanly possible, and then that's why we're doing this. And if she lives 100 years, then we're going to do the same thing there. So, but I think when you're in the special needs area, you have to kind of think about where you're at. And again, everyone's at a different place. There's nothing wrong with, we have friends who are missionaries in Indonesia, and I would never be a missionary in Indonesia. I think it's way too risky. So for me, that's, and they don't judge me because I won't go to Indonesia. I am in my place. I'm serving the Lord in the way that I think He wants me serving. So it definitely has to be something, like when we, and again, when we adopted her, my wife's parents initially had a hard time with it, and so for us, I'm in their house right now. They've been praying for us giving this talk, and my wife's mom is doing Talia's work with her. They just love her to death, but that was a process we had to work through, and for us, we had to be like, okay, if none of our friends talk to us and our family doesn't like us, you know what? It is what it is. This is what the Lord wants us to do. The outcome is not for us, and I don't think people have that experience, but you will not go unscathed through this. And the, like with our family members that have a hard time with this, I literally, I've never felt that kind of anger towards a human being before. It's been 9 years, and I still pray about that all the time, because if I don't, even right now as I'm talking about it, I'm feeling myself getting a little bit upset about, so it's it is not an easy road, but in terms of being meaningful and in terms of impacting the kingdom and in terms of what the Lord would have us do, I've not done anything in my life that I feel is more in line with all of that. So, are there more questions? I don't see.
Yeah, so the next one is, do your friends know that she has HIV, and how did they react? And I think we've covered that a little bit in some of our responses. Yeah.
So again, I would say that, all of our friends that we have over into our house pretty much know. People that we see at church that we don't know that well, or like her sports teams. I don't tell anyone on her sports teams, just because it's not their business. It doesn't affect what she's doing. If she was, this is a weird thing. Like, I don't know, Talia is more of a thinker than an athlete, but I mean, if she wanted to play, like, I don't know, like competitive women's lacrosse or something, where there's a lot of physical, I don't know what you do in that situation. I don't know who has to know, so, but yeah, and again, most of our friends, I mean, I want the people around her to know so that to protect her. Because the other thing that's interesting about it too is, like I want the people around her to have the flu shot because I don't want her getting the flu. The flu is a disease that affects your immune system. So I don't think she's a risk to them, but, and again, she's actually had the flu before and was totally fine. But I just, as her dad, I don't want her getting that stuff because I know that her immune system, while it works and is in a sense normal, it's doing extra work. All right, so other.
Oh, I might have skipped one. So the next one is, how do you prepare your child for others who reject them because of HIV? Or how did Talia handle that type of a situation?
Yeah, so it's interesting. So Talia, at her age, has not really, I mean, her doctor and the social worker there have already kind of started to talk to her about that. And we're very, we're a very open family. So, we've talked to her about sex and, like what that, like, because Talia's a very introspective kind of a person, so she has questions. So I just am very honest with her. And honestly, we tell her that people are afraid. There's a group of people that will be afraid. And when people are afraid, they're sometimes mean. We've also told her that there are a lot of people out there who are just mean, and those people will be mean, and that's why, we've told her for now, when, one is, we told her for now to not tell people that she has HIV. And we say if it ever comes up and anyone ever asks you a question, like, do you have a medical thing, whatever, you can say, oh, you can either say no or say I have a little blood problem. Yes. So we tell her this is a blood disease, like hemophilia or, whatever else it is. So, and then, but honestly, she is Black, she is female, she has HIV, there are people in her life that are going to be mean to her, for all those reasons, unfortunately. So, that is one of our greatest fears as parents is that, that she's going to be out there. But we are definitely preparing her for the fact that that's just the way life is. And again, we talk about this all the time. 99% of the people who we know, we love and are great people. And then there's 1% of the people who are going to be mean people. And Talia has been to Cambodia for 3 different years, and she's been to, El Salvador, and like we've traveled, like we're like, these people are living in, so we try to make them aware of the world. We live in such an amazing place, and but so we've told her we will in small ways face these trials that these other people face every day of their life. So that's kind of how we deal with it. It's going to be a process, I know. And as she gets older, I'm suspecting trouble is coming in late adolescence. Our doctor has told us that takes care of these kids that some kids stop taking their medicine. They just don't want to take it. And this is for diabetes and other things. We see this all the time. And so they take it very sporadically from about 16 to 19. But the funny thing is you can stop taking your medicine for probably almost a year. If you started taking it again, you'd probably be fine. But we don't ever tell her that. If she misses a dose a month, we like are all over her. But yeah, so so these things are going to happen. And when she's dating in high school, what if I mean, of course, my daughter would never have sex before marriage, but you know what I mean, like these are things that will be, we're going to have to deal with these things, and how we'll deal with them with her is very honestly and openly. But then how she deals with them is going to be she'll have to walk that path.
Great. So this question is, since the virus lives in the immune cells, are children with HIV who are on medication more susceptible to sickness? Is there a higher risk for immune-related diseases or cancer?
So as far as we know now, there is not a higher risk of immune-related diseases or cancer. But again, I don't know when she's 50. That because over time, we don't know. So, and in terms of infection, it's interesting because I've worked in the hospital for almost 20 years now, and I've never actually admitted a kid to the hospital for HIV, and I rarely, almost never have to admit one for the flu, or kids that have cancer, that have ulcerative colitis, that have cystic fibrosis, they get admitted all the time when they get exposed to other illnesses that their body can't deal with. But with HIV, when you're healthy, you just don't get that. But now when you're older, I don't know as much. But like our peds infectious disease doctor basically says, look, do whatever you're doing. You do not need to protect her in any way. You don't protect your other children when she's taking her medicine and everything's okay. So yeah, again, I don't want to paint too rosy of a picture, but the reality is you don't really, in terms of like when she's older, if she wanted to go overseas or go to Europe, it wouldn't concern me. We and this is where we're maybe a little bit off. Like we did work in TB villages and stuff. And we took her with us. So I personally don't have any. I don't want her getting TB. I don't want any of us getting TB. But I'm not. I'm not overly concerned about it.
Okay. This one is asking for your advice on sharing HIV positive status with grandparents that they already think are likely to react negatively.
Right. So, and this is where, the decision we made is to pray daily and to make decisions together. Like my wife and I, when now that Talia's older, we actually involve her in these decisions, but to just pray about it, come to a decision in prayer that we feel like the Lord wants, and then move forward with that, knowing that it might be wrong. And for us, we knew that her family was going to have a hard time with this. And the way we felt was like, Talia she is our daughter. So the same way if you have a biological daughter or another adopted child, if someone has a problem with your child, they either get over it or you don't deal with them. So for us, that was kind of the decision we made with family, because we did not, in our, honestly, we don't have, like our grandparents, Talia's grandparents are like, were 60, whatever, when she was adopted. So they were young, they were involved in our lives. So, but like our great grandparents and that, we don't really see them that much. We didn't tell them. But yeah, it's and it's hard. And I think that, and the Project Hopeful information does a great job. So the thing that's hard is, like when we adopted Talia, I wanted to just scream it to the world, because I thought, like, the Lord has done this amazing thing in our lives. And I'll tell you, like having children or anything, we're not a blessing to Talia. Talia is remarkable, and she blesses us every day. That what we give to her is a fraction of what she gives to us. So but a lot of people, I mean, if you're an adoption, then you know this already, that a lot of people, when you're adopting, you're really excited about it. A lot of people are like, what, you can't have your own kids? That's a bummer for you. So you kind of, as the HIV, sometimes you kind of deal with that as well. Oh, I'm glad you're adopting her, but I'm sad you couldn't get a healthy child, that you had to get one that had HIV. and people don't say that out loud, I haven't, but I think you kind of get the sense that, I remember, when we talked to my uncle who, their family had this problem with this, he's like, I can't believe you would adopt a child who's black and has HIV. Like his worldview could not process that. Basically to him, her dying in Ethiopia is a much better outcome than her being here with us. And that's just how he felt. And he's never moved away from that. So that's the kind of, when you adopt, that's the kind of personal pain that is, you got to deal with. Well, hopefully not, but I'm betting you will.
Could you explain why she had to wait to go down to one pill? Why younger children have to take multiple pills or liquid?
Yeah, so the liquid you just have to take until you can swallow a pill. And again, I've seen an 18-month-old swallow pills, so you just have to get to that point. And a lot of it has to do with the treatment of HIV is still evolving. As I follow it and talk to an infectious disease doctor, like the one pill you're taking once a day now, they wouldn't have given the kids 2 years ago, just because it wasn't studied enough. Mm-hmm. So it's my guess is as time goes on, this kind of one pill once a day is going to be the norm for just about everyone. So HIV medications are dosed and made for adults because for drug companies, 99.9% of the people that have HIV are adults that take pills. So, in the world, a ton of kids have it, but none of those kids are paying for medicine. So there is no incentive for a drug company to develop HIV medications for children. Like amoxicillin, they make amoxicillin for kids because they sell a ton of it. But anti-HIV medications, they're not going to sell it. They're going to be forced to give it away overseas. And here there's just a very small percentage of kids that have it. So that's why those medications for kids under, say, the age of 6, they're just not designed that way. So you kind of, like for a while, she had to take a pill and then some liquid of one of the medications because of the way the pills were done. There wasn't one that fit her weight. So, under 3 and then under 5, you have to kind of deal with this medication thing.
Okay. So I can speak to the next one in terms of, are the children being treated while they're waiting to be adopted? So like I said, the 2 biggest programs that have this need right now are Haiti and India. I can speak to India. The children in India, the general thing that I have seen is that children under 2 in orphanage care are generally not being treated unless they're symptomatic. Children over 2 are generally on ARVs and being treated. I have not seen a situation, whether working in the India program or in the Ethiopia program, where we had children that were older, not treated, and very symptomatic and really feeling the symptoms of their HIV. I've not seen that situation. And I would also make the point that children under 18 months, Dr. Van Winkle could talk about this more, but children under 18 months, we're often not fully sure if they actually have HIV themselves or if they're carrying the antibody from mom. We have placed multiple children in the India program under the age of 18 months that came home and did not have HIV. They were carrying mom's antibody. So I don't say that to say you should say yes to it because they may not end up having it. I definitely don't want to give that message. We only place those children with families that are open to, prepared for, resourced for HIV if they're under 18 months. But I do say that to say that's part of the reason that we don't see them necessarily treated if they're really little babies and on ARVs. We don't really even know at that point if they definitely have the illness.
So I agree with all that. And right, and a lot of the testing is done is based on antibodies in your blood. So antibodies are these little things that run around your blood. And you can definitely have antibodies from your mom for months and months. So that's why they test positive. Oh, sorry, go ahead.
Sorry, anything else on that?
No, I totally forgot what I was saying.
So the next one is, can children grow immune to their medications?
So all viruses mutate. Bacteria actually mutate as well. We kind of mutate as well, but we won't talk about that in this form. But, so viruses mutate. So that's why right now they're using this combination of 3 medications. Because what they found is if you give one medication, over time, the virus changes and becomes immune to that medication. So right now, when you use the 3, they are not finding with these 3 medications that the virus is changing, but it is, there are different, like any virus, like when you get the flu, there's a lot of different kinds of the flu. Well, for HIV, there are actually a lot of different kinds of HIV. It's all HIV, but it's kind of like, so there's a phenotype and a genotype. So your phenotype is kind of, what it looks like in the big picture. The genotype is kind of when you get down to all the little nitty-gritty parts of it, how is it different? So it's like a car, to someone who doesn't know, a car is a car. But of course, when you get in the engine and the car, there's all the little, they both have seats, but the seats look different. They both have engines, but the engines look different. So, all viruses are kind of that way. So one of the things that they'll often do is when you come home, they will get this whole phenotype of the virus to see, is this a virus that's more mutated or less mutated, and then they'll tailor the treatment to that. So for Talia, they were actually thinking about starting her treatment, but I said no, because I wanted her to come home and have this phenotype before she got exposed to any HIV medications. And that was just my personal thing. And she was a little bit younger, she was 10 months when we brought her home, I think, so when we got her home, she had over 300,000 copies of the virus per very tiny drop of blood, if you can imagine that, but you would never have known. I mean, she was totally fine, and that's the weird thing about it. And then once we put her on medication over the course of a few months, it was basically gone from her blood from any normal way you detect it, and it's been gone the whole time. Now, it's still, if you go in and you can open these cells and find it in there, but in terms of in her blood, you don't see it.
Is there a difference in risk of transmitting the HIV, whether it's the man or the woman? Is there a higher risk or?
Yeah, so yes, so kind of getting down to the nitty gritty, just to start off with, it has to do with trauma and mixing of blood. So if so in the homosexual community who is having anal sex, there's a lot of trauma and a lot of mixing of blood. So that is why that group they're high, they give it to each other quite a bit in that group. So, so for between a man and a woman, because the man is in a sense a lot of times causing more trauma in that process of having sex, they will, and because it can be in the semen, they're more likely to transmit it than, say, a woman. Now, in the vaginal secretion, there is some virus in there, but, again, there are couples and people, that just decide, hey, we know, but we don't want to use a condom or whatever. We're just going to have sex. We've been married. And a lot of times, especially if the woman has it, they don't necessarily transmit it in kind of normal sex. But yeah, it all has to do with blood getting in, someone else's blood getting into your bloodstream. So like, for instance, if I have a cut and Talia has a cut and her blood gets on my cut, it's very unlikely, because your blood doesn't bleed in, it bleeds out. So if my blood is coming out of my hand, her blood is not going to go in. So it's all about kind of mechanisms. Now, in breast milk, HIV is definitely in breast milk, and for moms that breastfeed, because they breastfeed over months, you can definitely, most kids get HIV through breast milk in that way.
How did you tell Talia, and at what age did you start telling her about HIV?
So we did not use the words HIV for a while with her. We basically, as soon as she was coherent, we started telling her, you have a blood disease, You're taking this medicine for it. It's a part of who you are. I wish you didn't have it, but you do. So we have to take this medicine. And I said, in your life, I've always told her in her life, it's going to be a hard thing, but it's going to be something that makes her life very meaningful. And it's going to be something that makes her a very sensitive and kind and compassionate and caring person, that when she gets older, she might be able to use it in the work that she does. So I've always acknowledged the difficulty of it and that we don't want it, but the fact that, there's going to be a lot of great things that, I had a really nasty type of cancer when I was a kid, and I was in the hospital like 800 days and 3 years getting treated for it. So I've always kind of used that, and I have some other kind of chronic health problems related to it. I know I look really good, you never know, but it's true. So I've always kind of used that with her as saying, look, I had this thing that I would not want to have had it, but the reality for me is I'm a doctor. I don't think I would have married, my life would have been on a different path. I wouldn't have married my wife. I would have, so I'm like, there's a lot, the Lord put me on this path, so I definitely, I tell her, you being in our family is something the Lord wanted. The Lord knew you were going to have HIV, and He allowed that to happen. So, we work with what the Lord has given us, and we go out and serve Him. And I said, you're going to be able to serve people in a powerful way, in a way that your brothers and sisters can't, because of what you have.
Yeah. And what's the best way to find an HIV specialist near your own area?
Yeah, any children's hospital or academic center is going to have one. So, okay. And the funny part about it is, like we're supposed to go 4 times a year. Full disclosure, we probably go twice a year, just because, because I kind of keep track of things. She's doing fine, but, it's all of her other care is done at our local thing. Her medications are given through our local insurance. It's all there for us. We have an HIV doctor here, but I didn't think it was the best fit for her. So I made our insurance pay to go to a local one who's not in our insurance. But so my insurance pays for 2 to 3 visits a year, and then everything else, the blood, the medicine, if she, whatever, we all take care of in ours. But there, if you just Google it, or any medical center is going to have it.
Okay. Is there any information on the long-term impact of taking these medications for decades?
Right. So yes, and I hope I emphasized that before, and that's a very good question. And the answer is no. And because just no one has taken them for more than, and even the ones they have now are new. So no one's taken, the ones is on now, no one's taken for more than 10 years. So and that will definitely be, that type of a thing. We know when people have been taking them for 30 years and they're doing fine. So and they are similar to other medications we use chronically. So we don't think there is, but this is like I'm saying, like about their lifespan and things like that. I don't know if at 50, 60, 70, you could have trouble. I don't think you're going to have trouble before then, unless something else weird happens. But yeah, as you get later on, you don't know. The other thing that's going to happen too is they're already starting to experiment with taking medications for a period of time and then stopping them and then restarting them. Because we know that there are people out there who have had HIV for 10 years who have never taken a medication and are totally fine. So right now, I have a feeling 20 years from now, we're going to be like, yeah, we overtreated all these kids for HIV. We should not have treated, I think that's what's going to come down the line is that right now, Talia every day takes her medicine twice a day. And for now, there's no discussion of not doing that. But the question is if your body really is kind of containing the virus, does it really matter if the virus is in your blood? If you're otherwise fine. Or instead of taking it every day, you should just be taking it once a week, or, and right now this concern about the virus changing and mutating is what's making the medical profession be like, no, take your medicine every day. because we don't want to allow it to mutate. But yes, there is a lot of unknown in this. And for those of you that have children, there's not more unknown in this than there is in just raising a child. But yes, in 70 years we're going to know. They're coming out with a vaccine right now that they think they're pretty close to. So all the social stuff, once they have a vaccine, a lot of that social stuff is going to go away. I think the 20-something generation is the generation of kids of people that our kids grow up with aren't going to care about HIV like we do at all. But if they have a vaccine or that's really going to change it.
Okay. Does a public school, can they require a family to disclose a status like HIV and then discriminate?
No, absolutely not. And in public school, and again, it all depends on it kind of depends on a couple things. One of our things about it is the thing we worry about is we do not want HIV for Talia to be something that we hide, because you can't tell a child that this is something that you're hiding and not have them feel like it's wrong in some way. I think you have to be very careful about that. So for us, this is not a secret. It's not something we hide. It's not something we're ashamed of. It is what it is. And so in that vein, because people would say to us, well, what if someone finds out? Well, what if they find out? If they're mean about it, then that'd be a bummer. But I can tell you, like if our public school or someone kind of discriminated against her because of it, part of me would want to just tell everyone, because 99% of people are going to think that that's horrible. Where I live, but absolutely, the reality is you do not have to tell. I know people who have died because of HIV that only the parents know. Literally, no one knows. That's tricky because of the medicine. But I definitely know of people like that, and it's working for them. So, but yes. So sorry, Elise, go on. I'm done.
No, it's okay. What's your feelings on a typical daycare environment? Do you think it provides too much exposure to viruses for a child that's HIV positive?
I really don't think that it does. And again, Talia, again, for us, like her sister seems to get sick all the time. So I didn't like that kind of stuff for her. But Talia, for whatever reason, and I don't think, something with HIV, she's just not a person that gets sick that much. So when she gets a cold, it is just a little cold. So I think it kind of depends on the kid. For Talia, she'd be fine. If my daughter Diana had HIV, who gets sick and gets fevers all the time, or for my younger one who gets febrile seizures, I'd be more careful, because I just don't want to deal with that. But again, the daycare thing is the issue with that will be, if someone finds out, or like those are the things you're going to have to deal with. It's social, and again, the daycare has no right to know. They can in no way discriminate against you from this. It's totally against the law, hugely against the law.
So we have, it's been about a little over an hour, so I'm going to take just one more question, and then I just want to say that if you have additional questions, you can email me at india@adba.org, and I can forward it to Dr. Van Winkle. Happy to do that. So don't feel like your questions have to end here. If you have questions about Haiti, like specifically how those children are being treated or specifics there, Haiti@adba.org is going to be the best source for that information. And so just one more for you. How have you handled like sleepovers, overnight type situations, camp? How have you handled that?
Yeah, so again, if Talia is going to spend the night at someone's house, then those people know. And partially how we are is, our kids don't spend the night that much. Like our kids spend the night out, we know these people. So, and so for like camp, like church camp or whatever, for me, I let the director know. I mean, or whoever I know there, I let them know, hey, um, you know, so I let a person know, or if they're staying in someone's house, I let them know. But again, for me, if I don't know someone well enough to tell them, I don't want her staying at their house because then I don't know them. Like I don't want them abusing her. I mean, to me, I want to know those people. And she's 9 now, so it'll be as she gets older, we're gonna have to, by about 12, this is with most childhood diseases. By like 12 or 13, the child has to own it. It becomes their disease. We're still, by the time she's, Talia's pretty mature, by the time she's 12, she'll be making these decisions. I mean, we'll be helping her, but ultimately, these will be her decisions. And we find that again with cystic fibrosis and diabetes, and we tell kids, you got to own it. You got to learn everything about it. You have to understand it socially in every other way, and then, so you can make informed decisions. And every child's going to be different, but and the one last thing is, and I know Elise said this and I said it, but if you are considering adopting a child with HIV and you want to talk to us, through the AWA thing or through Elise, just email me, and I'm happy to spend as much time as you need. My wife is a lot smarter than I am and a lot more sensitive, so she would be a good person for you to talk to. Our greatest, like when I wake up in the middle of the night and like I'm in like a panic and a cold sweat, and I remember because Stephen Curtis Chapman said this, right? I heard him speak like 10 or 12 years ago or something, but it always stuck with me, and I feel the same way when I think that we almost let fear or whatever it is get in the way of adopting any of our children. It panics me because I think, what if Talia was not in our life? It devastates me to think about that. And I'm not saying that to say that you should adopt a child with HIV, but I'm saying that if you feel like you are in that place with the Lord, and the Lord is telling you, hey, yes, this is something I want you to do in your life, all of this other stuff, once you have her, or your child, you just love them. And all the other stuff just becomes stuff. The same way that, I was really sad for my son to not make this club soccer team that you want. Like it doesn't feel different than that. You hurt for them the same way. My daughter is Chinese and she's 12 and she's like 50 pounds. And sometimes people will make fun of her because she's small or whatever. And that, it feels like that. It doesn't, it goes into that same bucket of these are my kids and I love them, and when someone's mean to them, I want to run them over with my car. But it's not different with HIV than it is with any of this other stuff.
Yeah. Thanks so much. Well, I hope that we have, I hope that this has been helpful, and I hope that we've gotten across kind of the heart of this presentation, which is not to say that HIV is a non-issue or to be overly casual about it. In all that we've provided, I hope that you have gotten the sense that there are some real challenges, whether it's social or medical, that there are some real challenges around this. But I think our heart in presenting this information is that we have families that are regularly coming to us open to things like a heart defect or cleft lip and palate or a hearing impairment. And all of those medical needs, as well as adoption in general, do come with challenges and grief and loss and difficulties. And so our hope is to just bring some more education and some more awareness around HIV specifically, because for some of those other medical needs, it's a bit more readily available, or in some of the social areas, it's not a social thing like HIV might be. And so it can be a little bit more difficult sometimes for families to kind of wrap their head around HIV or get resources that they feel like are helpful. So that's the heart behind this, and I hope it's been helpful. Thanks so much, Dr. Van Winkle, and thanks to Talia for being brave and sharing with a webcam full of people. We love her and we appreciate it. So I hope this has been helpful. Again, if there's any question we didn't get to, email it to me. I'll pass it on, and we'll make sure that you get the information that you need. All right, have a good afternoon.
Bye. Aye. Thanks.